A great panel. Thank you again, Charlene and Judith, for putting this all together. And I think you see in the title that it says using data to drive practice and policy. I left out standard because I feel my colleagues on the panel, Melissa and Whitney, did such a great job. And on separate occasions, I have helped assist them in the standard development. And I go, wow, look at the presentation today. What a great job they have. So congratulations. Let's see. Oops. Can I go back? Which is this? Oh.
Just click out of that.
Oh, previous.
Where is the mouse?
Oh, I can just go.
And then you can use these keys
Okay.
here.
Perfect.
Or you can use this right here.
Perfect. So, all right. So, yes, I am Joyce Lee, head of a green health practice called IndigoJLD. And with my recent appointment at the University of Pennsylvania, I will be developing Building Healthy Places initiative across several schools on campus. It's all quite exciting. I was asked when I served as the chief architect of New York City OMB to talk a little bit about this, the backstory of the active design guidelines. I was honored to be a co-author and to talk about the stories of how it not only won awards from the Robert Wood Johnson Foundation and the Sustainability Building Industry Council, but that it made a dent in the design and the green building world. Despite I guess a lot of the major graphics that you see in the book, we would like to think that it's more than a coffee table book because of the research that we reach into. It cited a number of the publications of the Surgeon General over the years, U.S. Health and Human Services, Physical Activity Guidelines, the American Journal of Preventive Health, the American Journal of Public Health and Preventive Medicine. And in the stair and elevator study to look at energy efficiency and the co-benefits of health, we cited the American Council for Energy Efficiency Economy. And of course, our own New York City Department of Health data analysis. Thank you, Whitney, for providing all the reasons why we need to be looking at active staircase, because we did cite some of CDC's research, and with the public health literature behind it, we look at how to put that into practice, such as natural daylight, visual interest as an anchor, as well as designing stairs at the point of pathway. We were also very fortunate during that time in the Bloomberg administration, where LEED was and is still a mandate to build to LEED Silver or better if you get public funding. So in putting the features of this book into the physical activity innovation credit in LEED, we are basically encouraging all of our teams who are building for New York City to use this innovation credit. We believe that getting the best practices out is key, and a lot of designers will notice that. This is a book with very few drawings, but a lot of photos, because we want to convey the message that the opportunities are now, they're all doable, and they're all feasible. And with an administration that is supportive of design and health, public project has to be systematically evaluating the application of this book and the use of the Innovation ID credit. And this is one example that I chose that really used this active design guidelines as a guideline. And I chose this because of the complexity and the scale of the project and the impact that it has. It's a mega project, a police training facility in Queens that has a construction value of over $1 billion. So you can imagine just trying to meet the LEED requirements in this project was tough because of the specifics of police training and the security. And adding on this active design criteria and the ID credit, it just meant more work for everyone. Perkins and Will were the architects. The design team was very receptive to applying this, and we actually have a staff member doing detailed documentation of how to apply this in the whole research translation, using art, using music that we talked about earlier, having magnetic door open to make those stairs accessible. These are new drawings, plans and sections out of the design to create the documentation for this pilot credit. So we believe that this extra work will shape future practice. The documentation highlights all the active spaces in the building and the quality of the vertical circulation. And these features are, of course, directly tied to the book. This is another project in the capital program, a health center. And we had asked our partner, the Department of Health, to take the lead. Another kind of ingredient to success behind the guidelines is this really multi-sectoral collaboration between city planning, between health, between design and construction, and transportation. And for those of us at the mayor's office, we really were able to leverage all the expertise of the different staff in the departments. So Department of Health had Dr. Tom Frieden as the health commissioner, and we were very fortunate to have a strong voice in him. At that time, when we were applying for the innovation credit to be approved at USGBC, this is actually a support letter that we drafted for him to have him lend his voice to the senior staff at USGBC. And what we did say was we cited how forward-looking LEED was in banning smoking in building as a prerequisite. So now it's time to fight obesity. I guess at that time, Dr. Frieden wasn't as much of a LEED expert, but he was really enough of a leader to trust our instinct. And of course, now he's fighting all kinds of diseases, chronic and infectious diseases at CDC. But we thank him very much during that time for his support. By 2009, our cross-sector collaboration paid off. The Physical Activity Innovation Credit got approved as USGBC, and the first building to achieve that was this health center near Central Park in Harlem. So fast forward to 2015, I would like to share another health center project in Philadelphia, where I live now. And designers now take the social determinants of health much more seriously since we first started. And one can see that this is an economically struggling neighborhood in Philadelphia. The project alone in this one block is adding over 20 trees to the neighborhood. Tree-lined streets and asthma have direct correlations, and designers have learned since then. Venturi Scott Brown is the architect. For this South Philly neighborhood, the household income in the area is $31,000 a year, and 64% of the population attain high school or lower, and out of which another 18% did not finish 9th grade. And we all know that education attainment and literacy are social determinants of health, and here we're building a project to address those social conditions. Moving a little farther ashore, I believe that research translation also has what I call meeting where they are, meeting your audience. So this New York City stair prompt was translated, adapted, but the graphics stayed the same. And this is a university campus in Hong Kong, and up and down the hillside, you can imagine how many elevators there are on campus and the kind of impact that it has. And the blue stair prompt was designed in Michigan. It looks like it's quite embraced halfway around the world. As we know, obesity is rising in Asia and in many developing countries. Hayworth is a furniture manufacturer in Michigan with a worldwide presence. And this Hayworth showroom in Beijing was the first to receive LEED CI Platinum for LEED version 4. So they were very proud of it. They embraced the sign because headquarters had sent it to them. They have the English version and the Chinese version, even though their project was on one level. They were smart enough and forward-looking enough to influence their Chinese landlord by putting it in the common elevator lobby. In West Michigan, our firm was the universal design expert for this YMCA project. I used the ramp as a proxy for the stairs and applied the guidelines because ramp count as much as stairs in the lead credit. We work with a great client, and likely this building will be the first building in the world to receive the Global Universal Design certification, and it's slated to open in a couple of months. And in thinking about data to practice, choosing pilot projects are really key. This particular Bronx affordable housing project that earned LEED Gold was really important because, number one, it was embraced and supported by HUD, and it made news a lot with Jonathan Rose being the developer. It also opened up the idea of access to nutrition in a major way when we are working on the guidelines. By the end of the Bloomberg administration, I saw that it was time for mainstreaming local food production in LEED building, another pilot credit opportunity. By that time, the USDA, the CDC, and Columbia University and other institutions have done research in health linkages to urban agriculture, farmers market, and local food. These were the studies used to be, that was for reference for the LEED Pilot Credit 82, which is another way to document dimensional data in practice. Very fortunate, I was in Grand Rapids at the time and saw the opportunity for this pilot credit application. The downtown market was just about to complete, and the team was very busy in the LEED certification stage. They were so convinced by this credit that they took out one innovation point and supplement this pilot credit in its place, and became the first building to get this pilot credit approval. Data-driven design can be attractive, beautiful, and economically viable. In order to comply with this credit requirement, 10% of the site's vegetated area has to be demonstrated as a food-producing area. This is the greenhouse space, as you can see. You can see the watering system, the piping, the growing medium in the space. My colleagues at the West Michigan Sustainable Business Forum were so excited about this groundbreaking project, meeting the first local food production pilot credit, that they wrote a white paper about the whole, again, ID point compliance. And you can see that, for example, one of the criteria is 1 square foot per full-time equivalent, and how the calculations were done, and how the plan reflected the criteria in the credit. All of this information now is accessible on the USGBC Pilot Credit Library webpage, and you're welcome to visit that. Again, if you remember the pains that we went through to do the credit documentation for the police training facility, again, we were doing that for the downtown market in Michigan. And last but not least, when Stair Week was conceived in Michigan, it is the same data to practice approach my firm brought to a community far from New York. And by 2014, we had the full support of the AIA, the U.S. Green Building Council, and the IIDA on this public campaign. And because we work with local county health departments, we were also able to enlist the local United Way to help spread the message. So building this coalition caught the attention of the governor's office, and he was willing to cite studies to inform policy and support this public awareness campaign. So I'm going to attempt to try to see if I can start the video. Uh-oh. Did I do that right? We haven't had too much luck with the video.
Is it embedded in the slide?
It was embedded in the slide. So this is Governor
Hello and welcome to the AIA Green Health Summit. It's great to hear you're coming together to talk about ways to build a stronger, healthier Michigan. We all want our fellow Michiganders to live longer, healthier, happier lives. And one important way to get there is to have communities that support health and wellness. This week, I issued an official proclamation to celebrate Stair Week across the state. Taking the stairs is an easy way to help Michiganders get healthy. Just 3 10-minute bursts of energy a day, such as by climbing the stairs, provides the same health benefits as a 30-minute aerobic workout. And losing just 10% of body weight can help improve the health of more than 1/3 of Michiganders who are obese. I applaud the AIA Michigan Green Health Summit being conducted today. This important collaboration of Michigan's architects, designers, and green building organizations is helping to create opportunities for healthier lifestyles. I also want to recognize the importance of LEED Green Building Design Pilot credits that promote stair use and save energy. I know you'll all benefit from sharing best practices on building design that promotes healthier environments and supports placemaking initiatives. Congratulations to Joyce Lee and Tamara Burns of the American Institute of Architects, Michigan, for convening this Green Health Summit. I wish you all the best, and I hope you have a great day.
So I guess one might say that Governor Snyder is as much of a health expert as Dr. Frieden as a lead expert. But like what Mark was saying, if we create champions, we can all get it done together. Thank you.